Victory Studios in downtown Little Rock, this is Capitol View.
The governor actually issuing an executive order today declaring a public health emergency. 1 year ago, life as we know it changed forever.
No details yet on who this person is that tested positive.
Over 300,000 infected, more than 5,000 dead.
Sadly, we have our first death from COVID-19.
Friends and families separated, businesses closed, schools shut down.
I am authorizing on Monday each school district to close their school for on-site instruction.
Masks mandated, Arkansans socially distanced, and 1 year later,
hospitalizations are down, positivity rate is below 10%, vaccinations are increasing, and compliance with public health guidelines is at an all-time high.
Arkansans fighting strong together, hope blossoming this spring.
We finally have a light at the end of the tunnel as far as combating this pandemic.
This is COVID-19 in Arkansas, 1 year later. And good Sunday morning to you. Welcome to Capitol View. I'm Jay Burr. Arkansas has officially been fighting COVID-19 for a year now. This week, I sat down with Governor Hutchinson to talk about the past year, what's it been like for him, and about some of the decisions that were made at the time.
It's been 1 year since we've been dealing with this virus. To the date here, I guess, going back to that day, kind of take me back to that day. What was that whole day like? Because I know in a couple press conferences leading up to March 11th of last year, you said, it's just a matter of time before it's here. And Arkansas was kind of one of those states hanging on to not having any presumptive positives, which, sounds like it's an old term now. Yeah. But I remember those days here. But what was that whole day like for you once you finally got word of it's here?
Well, we'd been working with Dr. Smith, our then Secretary of Health, and we actually understood that we're going to get a case here in Arkansas, and so we are making plans as to what actions we should take when that happens. So as soon as on March 11th of last year, we have had word that we had a case, we announced that we're going to create a statewide emergency, and I declared that. Secondly, we moved to put in some public health guidance in reference to that. But what's amazing looking back to a year ago is how much we did not know. And when we had even such few number of cases, the concern as to what we saw in Washington State with the rapid invasion of that virus into our nursing homes, the deaths that have resulted from that, we didn't have our therapeutics, our hospital priorities or criteria set for treatment very well. And so the unknown factor created an enormous amount of fear that we were having to deal with and try to calm the public. And that's why you saw my news conference every day for close to 100 days.
Yeah, and I was there for plenty of those, that's for sure. But kind of looking back on things, and obviously, you were dealing with the information you had and just what we knew at the time. But do you think, the rapid shutting down of everything, was that the right course of action? Do you think, especially at the time, considering, we only had, the one case, there was a couple of other presumptive positives, I assume, that were in the works?
Well, that's a perfect question, and if you look back, we first closed the schools in Central Arkansas because that's where the first outbreak of the cases were. Now, in hindsight, was that a good call? There really wasn't much option because the parents did not want to send their children to school because there was such fear and concern. Educators were not wanting to have to make the decision at the local level. They wanted statewide guidance on this. And so we first made that decision in Central Arkansas, and that eventually was expanded statewide in the spring. Now, as we learned more, we were able to say last fall, we're going to be opening up school to in-classroom instruction because we had PPE, we had a better understanding of it, we had the mask mandate in place, and and specific guidelines. You look back, was it the right decision? It was a necessary decision. It was a necessary decision because of all that we did not know and the concern that parents and educators had. Obviously, if we knew everything that we knew today, we could make different judgments, but also we would have to have, the PPE, the personal protective equipment, in a larger quantity that we did not have there. So it was a multitude of factors that happened last March and April that are not existent today. So we made the necessary decisions at that time.
And kind of getting into some of the PPE, and I know that's not necessarily on the sort of the anniversary of things here, if you will, but what were some of those discussions like in the early going once we knew, okay, this is going to be an issue of some kind here? What was it like having to maneuver through those waters, and especially when some other states, and I know you mentioned it several times, some of the bigger states, where everybody was competing with each other for the same stuff. So, what was it kind of like to wade through those waters early on?
It was the most challenging environment that I'd ever seen in terms of having a commodity, PPE, that everybody needed globally. It was necessary to fight the pandemic, and every state was left to their own devices to try to get that. And money was not the challenge. We devoted over $70 million to acquire PPE on the global market. We set up a mechanism to do that, but it was a jungle out there trying to get the PPE for our healthcare workers. And this is, you think about the challenge, we were worried about our hospitals and our medical clinics not having the necessary protective equipment to deal with the virus. And that was the first place to secure. And even then beyond that, it was the dental offices, it was the schools, it was in the factories, because our poultry workers had to go to work, and we needed that everywhere. And so it was a crunch that, thank goodness, we were able to get over with increased manufacturing capacity. But for probably 4 or 5 months, it was a challenge that we don't want to have to face as a nation again.
And even for you personally, leading into that, when you knew this is inevitable. It's going to get here in Arkansas. It's just a matter of when. But for you personally, what were those emotions for you? I'm sure that you had plenty of sleepless nights leading into that, and then even into the couple of days afterwards. Having to make those decisions, big bold decisions, as you said. Very necessary decisions at the time. For the governor himself, what was it like for you personally?
Well, it was tough for me, but it was tough for every Arkansan going through this pandemic. I'm grateful that I did have the experience working in Homeland Security after 9/11. I was in an emergency environment then at the national level. I knew how to handle emergencies, and so we were able to put that kind of experience to work here in Arkansas. Now, that doesn't necessarily make it easier, because there's a big difference in fighting terrorism versus fighting a virus that you can't see. But the principles of organization and having the right team in place and the strategy is the same. And so for me, it was having an incredible team in place, working hard on this every day. I didn't run for governor to fight pandemics. I ran for governor for education and job creation, but this is thrust in my lap. But you could say the same thing for everybody in Arkansas. And every time I thought that I had a tough job, I thought about our medical professionals that are really the heroes of this, particularly in the early struggling days. And they're giving their heart and soul to save lives. And so I think we encouraged each other, seeing the stamina, the devotion, and the commitment to saving people's lives. And so you have to make decisions. The tough part for me is that, I have advice from our healthcare team. I have advice from the community and businesses, but ultimately I have to make a decision. And so that's the most important thing about leadership, is making a decision with the best information you can, and then you adjust as you need to.
And when we come back, more of my interview with Governor Hutchinson. You're watching Capitol View on Sunday morning.
No delay, take home today at Overstock Furniture and Mattress. With 0% interest and no credit needed purchase options available, we're overstocked on living rooms from $5.99, bedrooms in stock from $7.99, all sizes of name brand mattresses in stock from $2.99. No waiting on dining tables and chairs from $6.99. No waiting weeks for furniture to be delivered at Overstock Furniture and Mattress. No delay, buy today, take home today with 0% interest and no credit needed purchase options available.
If we pop him, all of this goes away.
He wants more than dinner.
Ew. The place is swarming with agents.
You all do this for everybody? Quite a situation we got.
Always.
You ready?
I can't believe we're both moms.
I know. At my school, the children leave their phones in their lockers during important events.
This Is Us returns Tuesday on NBC.
You know every tear, every smile, every heartbeat. You have watched them grow, and you have become closer with every moment. At Health Mart, we understand. We know you and your family and your healthcare history. We know our community because we are locally owned and operated. Pharmacists you know, trust, and who know you by name. Health Mart Pharmacy, caring for you and about you.
Looking for your one-stop shop for all your boating essentials? Come to H2O Sports and Marine. From top brands and knowledgeable sales staff to quality parts and expert service, we're here to help you find exactly what you need. And now with locations in North Little Rock and Greers Ferry Lake, H2O Sports and Marine is here to get you out on the water in a boat you'll love with service you can trust.
Watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back into Capitol View. Arkansas has been fighting the COVID-19 pandemic for a year now. As was the governor, he has been making decisions for a year now. More of my sit down with Governor Asa Hutchinson.
What went into prioritizing whom for the vaccine? Because, you know, everybody is essential. There's a lot of different groups that became more essential as this thing went along. And two, you know, everybody can make an argument for, you know, my subgroup ought to be next in line or first in line for the vaccine. So I guess kind of, and I think a lot of people understand too that, you know, supply is limited. You can't just open this up like the Wild Wild West. So I guess when it came to that, forming those tiers, you know, kind of what went into those decisions?
Well, you start with the CDC guidelines that they have national experts that make judgments both in terms of equity, in terms of critical industries that have to keep our country going. And so they gave us the starting point of the guidelines, but they are guidelines and the governors have some flexibility beyond that. And every governor made adjustments based upon their states. For us, we moved teachers up because we were keeping our schools open. That was an adjustment we made. There were some confusing points as to whether it should start at 70 plus or 65 plus. We started at 70 plus in age and moved down. And so we start with the guidelines and make adjustments. I think we also made adjustments based upon whether you want to have everybody lining up for 3 miles to get a vaccine in an uncontrolled atmosphere, or whether you want to have it in a more organized fashion. I made the judgment that we ought to be doing this one category at a time, so that it's a more organized system in which you don't have the elderly out there in the cold of winter waiting for a vaccine. And so we made those judgments. Thank goodness the vaccines are increasing in the supply. We're opening it up to more categories, and come April, we'll open it up to the 1C. And you're right that, you know, everybody's essential in their work. But what the CDC guidelines is, you know, what is necessary for the health, getting food to everybody. Well, there's certain people in that category, or energy, turning the lights on. Those are critical industries that we have to keep going, and so that is critical is probably a little bit better word than essential, and that's one of the divining points that they made.
Is there anything that we've learned about Arkansas this past year? I mean, obviously, you know, the healthcare system, for example, pretty robust now, or pretty flexible on top of that, able to sort of ebb and flow with this thing. But when it comes to certain things, I know internet was probably bumped up maybe 15, 20 years ahead of maybe what it would have been had this not happened. But are there some things that you've sort of learned about Arkansas during this past year?
A tremendous amount. Just reinforce what confidence we already had in the resilience of Arkansans to fight through emergencies like this, keep their head up and plow on. But you also, everyone has grown in their inspiration and appreciation for our healthcare workers that have inspired us, that have saved lives. And then you also, from my standpoint, I look at the public health department that it just quietly does their work year after year, and all of a sudden we come into a pandemic and you think, this is why we have a Department of Health. And without their incredible work in which they've worked so many long hours over such a long period of time has helped guide us through this. And then you also learn something about people and how they respond. And it's been tough because we've lost so many Arkansans from this, and it's touched my life, it's touched so many families in our state, but they love them, and then they fight through it, and they recognize that the tremendous costs that this virus has brought us.
I guess, too, when it comes to other states reaching out to you for advice on, hey, you got, you know, schools, for example, as you mentioned, you know, hey, what have you guys done that's working for you that maybe we can apply? I mean, how much of that have you gotten? Because, you know, a lot of times, you know, you think of, you know, your New Yorks, your Texases, your Floridas kind of leading the way in most things, but it seems Arkansas has kind of had their fair share of, hey, we're leading the charge when it comes to X, Y, and Z. What have been some of those X, Ys, and Zs?
Well, that's probably a large part of it, both in terms of keeping our schools open, but also how we handle sports. And one of the things that I've grown to appreciate is how incredibly important the opportunity for sports is to the lives of our young people in their mental health, in their growth and character building. And so thank goodness we were able to keep their sports activities alive in a safe way for our students this past year. But probably one of the enjoyable things is that President Biden rightfully is pushing to open schools. And so I'm on my calls with the leadership team in Washington, and I say, well, we were open last August for in-classroom instruction, and then they pushed to have our teachers vaccinated and moved up in the line. Well, we've already done that. And so I do think that we were ahead of the curve, particularly in terms of education and realizing the importance of that to the mental health of our students. I really heard for some of the states that kept their schools closed and they're not teaching, it's all virtual, and I think about the long-term consequences of that. So we didn't do everything perfectly necessarily, but that's something that we got right. And the credit goes to our educational leadership and our teachers that are out there. And I know it's been tough, but that's one of the reasons we want to make sure everybody got vaccinated and have that opportunity.
You mentioned just the importance of sports, and when it comes to mental health, you're finally back out there on the b-ball court now. I mean, for you personally, because I think a lot of people understand, you know, basketball is your thing. You know, how much, you know, being able to sort of interact with folks now in a safe manner to be able to play, how much does that, you know, kind of clear your head and, you know, obviously, you know, it gets you out and about?
Well, it makes a big difference. And during this pandemic, you talk about how I've handled it. The importance of getting exercise has been critical. It helps me to get through the day. But we had to shut down our basketball for 3 months or something like that. And it was really something that I missed. And so we re-engaged it, first just 3-on-3. We wore a mask. We gradually expanded that. And so now we're back playing full court again. We're wearing a mask. At some point, we'll get all vaccinated. That'll end. But we've had the safety protocols in place. But you have to have that social interaction with your friends, but also it's just simply the exercise and the joy of that competitive sport.
And when we come back, the legislature still passing some bills. We've got some of the highlights coming up after this. You're watching Capitol View on Sunday morning.
I want a glass that I actually liked, so last time I paid $600. This time I went to Success Vision and got a pair that I love for $280. All in.
I was surprised by how many brands Success Vision offers.
I was able to get the ultra-thin lenses for half of what I used to pay.
The staff is really friendly and they're competent. They help me find glasses that really fit my face.
Eye doctor next door, same-day service, curated eyewear. It's just a good overall experience.
$2 for $39 in an hour for less. Come see us today, Success Vision Express.
Love lower than low prices? Then get more ways to save at Kroger, where you can find personalized coupons, weekly deals, and rewards like fuel points. All for prices that are lower than low. On food that's fresher than fresh. Kroger, fresh for everyone.
Hi, I'm Missy Gibson. At John Gibson Auto Sales, we offer our customers the opportunity to buy almost any vehicle. We have over 900 cars, trucks, SUVs, motorcycles, ATVs, campers, performance trailers, and boats. We will finance your purchase in-house regardless of your credit history. You can actually make your purchase from home or on the go. Simply go online to johngibsonautosales.com and take a virtual tour of our inventory. We call it shopping made easy. See you soon at John Gibson Auto Sales, in person or online.
Plantar fasciitis feels like pointed, sharp pain. It just hurts all the time. It feels like your foot is squeezing on itself. When I drove past the Good Feet store, I thought, I'm gonna stop in. They wanted to make sure that they gave me the right arch support for my feet that were personally fitted just for me. Then it was like, okay, this is something special. These make a difference.
See for yourself with a free personalized arch support fitting at the Good Feet store.
Natural State Funeral Service provides Arkansas families affordable funeral services for their loved ones. Our traditional funeral service with a casket starts at $29.95. We also offer on-site cremation for $6.95.
A Natural State Funeral Service serves Arkansas families with dignity and respect.
Attention Medicaid recipients who need incontinence supplies. You may be eligible to receive your supplies at no cost to you. Since 2006, Family Choice Nutrition and Medical Supply has been a leader in home delivery for seniors, disabled adults, and special needs children. Call now.
We're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back into Capitol View. Last Monday, Governor Asa Hutchinson announced the rest of Group 1B would be eligible to receive their COVID vaccinations. The governor expanded the list to include all food and agriculture industries, essential government employees such as legislators and their staffs, along with Chief Justice Kemp's recommendation for judicial staff, postal workers, public transit, houses of worship, manufacturing, and grocery store workers and meal delivery. Eric Herget owns Heights Corner Market, and he says his 15 employees were excited about the opportunity to get their vaccines. Herget is thankful none of his staff have contracted the virus and says grocery store workers have been frontline workers during the pandemic, and it's good to finally see them get their turn.
We're glad it's our time up. Everybody has, like I said, been on the front line since day one of this, and no one that I know of in any grocery has stayed away from it. They stepped up and did what they had to do.
And those with intellectual and developmental disabilities originally in Group 1C have been bumped up to 1B. The governor saying many in this population live in long-term care facilities. So to round out this sector of Arkansans, he decided to go ahead and move them up. Lawmakers presented a bill Wednesday that would greatly enhance renters' rights in Arkansas. State Representative Jimmy Gazaway presented a bill to create minimum habitability requirements for landlords. It would require units to have things such as working plumbing, safe wiring of the unit, smoke alarms, and working heating and air, among other things. Gazaway says many other states have provisions for renters, and landlords get along just fine. Opponents say this will actually increase the cost of doing business.
We're not asking for gold-plated fixtures. We're not asking for a jacuzzi tub in every
rental unit. We're simply asking for the very basic minimums that affect health and safety.
But I've notified my tenants if this passes, their rent is going up $75 to $100 per month.
Now, the bill also creates the framework for a more expedited and less expensive process for evictions that aims to protect both landlords and tenants in certain situations. The committee will revisit this bill on Monday for a potential vote. A new bill has been filed that would allow for collegiate student athletes to profit off of their likeness and image here in Arkansas. The bill says student athletes can sign with an agent to help them secure those endorsements, all without losing their eligibility to play. Now, this law was crafted under the guidance of the NCAA so it would not conflict with any current rules. Administrators support this bill because they say the state schools will be at a disadvantage if the state does not have a law like this.
As long as it's legal, was under the grounds of the NCAA, and it's not, they're not getting money from, boosters and not getting money outside of their scholarship from the school, I feel like they should be able to make money out.
That we have to make sure that the athletes are protected, the institutions are protected. I think he struck a really good balance here. I think this is about as good of an approach as you could take into this situation.
Now, gambling, firearms, pharmaceuticals, tobacco and marijuana, and alcohol are some of the things that are off limits for athletes to endorse. And we are back to wrap it up after this. You're watching Capitol View on Sunday morning.
The leaves are beautiful until they end up in your gutters. But with Guardian Gutter Protection, you'll never have to clean your gutters again. Let us keep you off the ladder and protect you and your home. Guardian Gutter Protection keeps out leaves, sticks, pine needles, even those annoying critters. We offer a 100% money-back, no-clog, hassle-free Guardian guarantee. Call today for our holiday special or check us out on the web at guardiangutterprotection.com.
No delay, take home today at Overstock Furniture and Mattress. With 0% interest and no credit needed purchase options available, we're overstocked on living rooms from $5.99, bedrooms in stock from $7.99, all sizes of name brand mattresses in stock from $2.99, no waiting on dining tables and chairs from $6.99, no waiting weeks for furniture to be delivered at Overstock Furniture and Mattress. No delay, buy today, take home today with 0% interest and no credit needed purchase options available.
We're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And that is it for today's show. Just go to our website for that full interview with Governor Asa Hutchinson with more on cooperating with other governors, on what he might have changed in hindsight of all those decisions, and who he takes great pleasure in shooting the J over in their pickup games. Now, we're back with an all-new Capitol View next week. Enjoy the rest of your weekend.